Hello friends, welcome to Dezinlife. Friends, in pharma industry nowadays different people are talking about something new normal. Now what is new normal in the pharma industry? Many short-term changes or short-term you can say impacts are being stretched to a long-term situation or kind of long-term strategy. I always mention that changes are continuous. Changes were happening pre-corona also, changes were happening 5 years back also, changes were happening 10 years back also, and they keep on happening. But unfortunately, most of the time, we don't accept those changes, what is keep on happening, and we keep on sticking something which was working earlier. But when some crisis happen, like now this corona crisis has come, then we suddenly start reading too much into those changes and that one-time changes. So this one time so many changes are not happening. So basically last few years what changes were happening and what changing trend was there, now they start become more visible or we start seeing them more often or more openly. So it is not some changes which is happening now. It is something which was happening already, but now they are becoming more visible. So overall these changes we need to bifurcate into two parts. One is what is going to be a short-term changes or short-term impacts, and what is going to be long-term changes or long-term impact. Now when we talk about the short-term changes or short-term impacts, these are being something more called like a new normal or something like that, confused as a new normal, which is not something new normal. This is short-term impact. So I will explain basically 5 different this so-called new normal which are actually a short-term impact. Number 1, we will have a difficulty in the getting the doctor's call as well as chemist call in next few months. This is going to happen. There will be no fixed month. Everything will start getting normalized. Month after month improvement will happen, but we may take say 6-8 months, or practically we can say 2020 will go in that way only in the passing this phase. But this is short-term impact. Second, using of the mask, social distancing, use of sanitizer, again it is going to be there, you can say across say 2020 or few months, something like this. But again it is not something new normal, it is a time being kind of impact. Down the line 1.5 year, 2 year time we will not see, we will still using same sanitizer, still using the mask and all. There will be more webinars, there will be more video calls, so-called Zoom calls, hangouts, all those things. Again some months they can increase, but if you look at down the line year or so, will not be so much. In next few months, there will be less of personal selling and more of digital way of approaching the customer. I'll say digital attempt to reach out the customer, or more of the talk of the digital way rather than doing something. And fifth, short-term changes will be, there will be low profitability due to sales loss, and due to increased cost of the API or the raw material, or you can say increased cost of transportation. So different our overall expenses, our operational cost will increase, API cost will increase, raw material cost will increase, maybe worker cost may also increase, and sale may be little lesser as compared to expected. So profitability will take a hit. So these are broadly I can say 4-5 near, you can say next few months impact we can see. Unfortunately, most of the people are calling this impact as a new normal, which is not the case. Now let us look at what is the long-term impact. It is something in store for something for quite some time, or something was happening, but we are not willing to accept these changes. We are not willing to accept this something, this is really happening. So I'll talk about 5 such things which are more of long-term impact, and we need to more bother about them. Number 1, there will be reduction in the field staff, and there will be increase in the span of the control. So one medical rep will be covering more larger area, and one first line manager will be covering more number of medical reps. Now the companies, there are certain companies, there one manager is covering say 3 medical reps, 4 medical reps. Now it has to go to 6, 7 or 8 medical reps. Most of the companies where manager is going visiting each headquarter maybe twice in a month, but in future they may be going once in a month only. So that is a change is going to happen. Maybe this corona crisis will give it a push, but it was due for quite some time. Smaller companies will find it more difficult to operate in the future. And they were having some pressure, but now problem is that one is they will be facing the problem in the availability of their products. Secondly, their margins will get shrink. Their operation will become more and more expensive. So when the operations become expensive, margins start getting shrink. So their operation will become, they will find it difficult to become more viable or profitability. So a smaller company will find it difficult. Number 3, the Me Too approach or Me Too products also will find it difficult. So one need to work on the customized strategy or the differential. I've been talking for quite some time that every company need to have their customized strategy, or you can say differential in their products. But now this corona episode will give it a further push. Change number 4, digital marketing will assist the complement personal selling. Digital marketing is not going to replace personal selling, but this will assist or this will complement, and overall the quality of personal selling will also go up. So basically there will be changes there also, and we will also see this, and this is something Pressure was building for quite some time. It is not something sudden. And change number 5, overall operational efficiency or the operational effectiveness will go up, and there will be marked difference in the overall sales as well as marketing strategy. There will be shift in the customers. So what used to be customer few years back and what will going to be the customer few years later, there will be change. What used to be our sales strategy or marketing strategy and what this will be, there will be change, there will be difference. So these are the 5 major difference is going to happen. So we need to focus on these long term or these more important changes rather than those short term changes. And as a companies, we need to identify, recognize these shifts more, which is going to affect more and more Indian pharma marketing. And I hope, friends, this discussion or this deliberation will give you some food for thought, and you will think about this, and this will help you in the building a strategy for your company. So thank you very, very much for watching us today. Thank you, friends.